It's 4 years since the Ebola epidemic in West Africa has started. Many of our East African friends fought Ebola in West Africa, and it caused us also to have a stronger focus on pandemic preparedness.
Well, a tabletop exercise is quite a simple exercise. It's designed where we give people problem statements, or we give them information that they can then read and digest. And then from that, they will then take that information and try to relate that to their own experience and also to their emergency management plans and planning that they've been undertaking. At the moment, what I've got them doing is I've given them information which should make them think that an outbreak may occur in the future. But this is a completely artificial and fictitious environment. So this is not really happening.
What kind of outbreak are we talking about?
Well, at the moment we're looking at a Rift Valley fever outbreak.
Rift Valley fever virus primarily circulates between ruminants and mosquitoes. Human infections result mainly from direct contact with blood or other body fluids from infected animals, or to a lesser extent, from bites by infected mosquitoes.
Like today we had an outbreak of Rift Valley fever. Are we able to manage it?
We are not.
Yes, the teachers' plans are there. Yes, SOPs, but standards are there.
Who are the people participating in this TTX?
Ni Shamos Abdurrahman Hassan, ni Imam, na Mosquito ya Jamii Mosque.
I'm Joseph Wakumo Nwonga, working as a port health officer at the Jomo Kenyatta International Airport.
My name's Jackson Ntipapa. I'm a farmer.
My name is Abel Nyangweso. I'm a chief tourism officer.
I'm a nurse by profession. I'm working at Namanga Health Center on the Kenyan side.
Damascent Kabanda. I work with the EAC Secretariat. I work as a senior trade officer.
My name is Elizabeth Merab. I am a journalist at Nation Media Group PLC Kenya.
And that is exactly what we understand as the One Health approach.
As African CDC, we have just established a new public health institute, and we are advocating for One Health. We are working with different partners now, but the scope is not yet as wide as what you did in the East Africa community.
The tabletop exercise was very successful. We were able to evaluate the whole exercise. Countries were able to appreciate that when you have an outbreak, you need to do something we call in WHO after action review, whereby you want to see what you did during the outbreak. Was it successful? What could you do better next time? What are the strengths? What are the weaknesses? And what are the opportunities that you need to use for the next outbreak that is going to take place?
Semina hii imetupa funzo kubwa sisi kama wilaya kule. Lazima tuwe na mfumo mzuri wa kuunganisha nguvu hasa kwenye haya magonjwa ya binadamu na magonjwa ya wanyama.
Well, One Health approach is one very good aspect that we've learned here.
Today I've learned that there's about 32 kinds of mosquitoes which actually can spread Rift Valley RVF.
Kikubwa katika hii workshop nilojifunza kwamba tunatakiwa tuwe tumejiandaa ili endapo tutakapopata magonjwa ya mlipuko tuwe tayari.
I've learned a lot, being that I'm not even in the medical field. I've learned a lot how to react when it comes to emergencies and how to prepare and the exercise was successful.
I've learned that it's of importance if we do early preparedness and even before the emergency comes in.